So guys, let's talk about hypertension. This topic has been a topic I want to talk about for a very long time. In case you're watching this for the first time and you're wondering what is hypertension, or you're learning for educational purpose, or your family member have hypertension, I'll tell you all you need to know about hypertension in just this brief video. So hypertension, we know hypertension is the increase of high blood pressure in the body, alright? So how to estimate that? We have to use this manometer curve to estimate if this person is having hypertension or the person is not having hypertension, right? It's 120/80 the normal value. The 120 is talking about systolic. The 80 is talking about diastolic. So now if you get to this point, diastolic means hypertension during exercise, whereas diastolic means hypertension during rest, right? Normally the diastolic does not change too much, but most times the diastolic is the one going more higher, right? So hypertension have four stages. We have the pre-hypertension, we have the mild hypertension, we have the moderate hypertension, then the last end was the severe hypertension, right? 4 stages of hypertension. So these stages is classified according to the values, because we thought hypertension is 120/80, right? The normal value. So if it's slightly increased, 122, 125/85, we'll say pre-hypertension. If it's more than that, like let's say 130/189, we'll say it is mild hypertension. If it's going above that, 139, 140, right, /99, then we're talking about moderate hypertension. If it's going above that, we're talking about 149 and 150 above we're talking about 100 and above, alright, 110. Then we're having severe hypertension, right? So this is the estimation. And we have another type of hypertension called gestational hypertension. This hypertension mostly occurs only in pregnant ladies, right? So it's not a common hypertension to everybody, right? So hypertension, what are the causes of hypertension? So hypertension causes can be divided into 2 types. We have the primary hypertension cause and the secondary hypertension cause. In the primary hypertension cause, what are we checking? We are seeing that most times not in the patient is fine, only the patient is growing, is getting aged, and the patient will be developing symptoms of hypertension. Mostly if you meet our grandparents, you see they have increase of chances of high blood pressure if they do a little physical hard work, right? So in the secondary cause, we are just saying that the patient is having underlying factor which is causing this hypertension. So how does this occur? Like if we're having acute injury, or we're having kidney injury, we're having things like impairment of our hormone regulation, secondary cause, accidents can play a role factor, etc. There's a lot of it. So these are the causes. So what is the risk factor for hypertension? Most times the risk factor for hypertension is family history. If you have a family history associated with hypertension, there's a chance you might likely suffer from hypertension in no time. Apart from that, age plays a role, like I told you in the primary cause. Our elderly have more chances of hypertension compared to the younger ones. Right? Age plays a role. If you're having a bad diet, bad habits, especially, a study has shown that sodium increases high blood pressure. I don't know how to rate that, but they say sodium. When we're talking about sodium, we're talking about table salt. It causes the increase in blood pressure. And the symptoms of hypertension, we can't use it in saying that this person have hypertension. Symptoms involve increase of heart rate. We have weakness, tiredness, fatigue, similar to weakness. So you can't use these symptoms and say, okay, this person is having hypertension, right? And we have other symptoms like nose bleeding. We have symptoms like someone will be having blood in their urine, you understand, etc. There's different kind of symptoms which are there, right? The only way to know that somebody's having hypertension, like the way I used to say all the time, the only way to know somebody's having illness is when the person has gone for diagnosis. And the diagnosis of hypertension, we can use ECG, we can use, I'll be talking about this in my later video when I'll be discussing the management of hypertension. So stay tuned, alright? subscribe to the YouTube channel, turn on the notification button. Alright, have a very nice day.